So, Dr. Bagai, what should one do? I mean, do you need to go to a doctor, or do you just take the normal course of, how you take steam inhalations, your usual medications that you would be having if you are used to getting such bouts, or is it necessary that you go to the doctor? Because there are long queues, a lot of people in the OPDs as well.
I tell all my patients and my colleagues that it's in two parts. One is precaution, second is caution. So in precaution, if you have upper respiratory or lower respiratory symptoms, please isolate yourself. The worst thing which you can do is, because it is an aerosol, it is an airborne infection, you can have a human to human transmission even within the household or in your workplace or your colleagues where you meet. Please isolate yourself, wear a mask at least for 48, 72 hours to make sure that you don't transmit it to others. But having said that, the real caution is no antibiotics are required as home remedy. No isolated home remedy, herbal remedies are required. Alternative medicine is required. Just give symptomatic cure, which is pain relief or fever medicine or a simple cough syrup. If the fever is high grade, that means more than 102, 103, if the fever is associated with severe cough or breathlessness, please consult your local doctor. If the medicine is required as antiviral, it's readily available as osteomilivir. It is very good in the first 48 to 72 hours. But if you start it late, then of course the efficacy is less. But the vaccines are available. It's an inactivated vaccine. It has a huge efficacy, more than 90% to protect influenza type A. It's extremely safe. It is cost effective. It's an annual flu shot. It's given to all age groups beyond the age of 6 months onwards. It's an absolute must. It prevents the respiratory infections, especially it's useful in the elderlies beyond the age of 60, 65. People who have comorbidities, especially diabetics, hypertension, past history of asthma, or chronic liver and kidney disease. Children are more vulnerable because they play in clusters. They have limited reserves of lung volume, and they tend to catch it from the school, child-to-child transmission very quickly. Pregnancy is again a very important factor to protect yourself, because this can transmit to the pregnant ladies because they are immunocompromised as a state. So simple precautions, there is no panic. Please don't take combination antibiotics or any antibiotic at all. Don't take combination painkillers. The worst thing which you can do is trying to have a magical relief with fever, and you try to combine various painkillers together. This will not only damage your blood counts, but also affect your platelet count. So we have to be cautious, simple approach, wait and watch game, consult your local doctor. The warning signs need to be looked after.
Last question, Dr. Sanjeev Bagai. People have now become very used to upper respiratory tract infections, for that matter. So in terms of nebulizers, is this advised? Particularly, post-COVID, people are very used to these things. So is that something, nebulizers, say Budecort or whatever, is it advisable that people use that without the doctor's advice?
So no medication should be used without a medical consult. Please, this is the most important carry-home message. The home remedies, which include, every cabinet at home contains a huge amount of very strong broad-spectrum antibiotics, which is unfortunately still available over the counter. Nebulization only if you have wheezing, only if it is medically recommended. Unnecessary and overuse of nebulization when you have no wheezing can cause tachycardia. It can affect your heart rate. It can affect your heart rhythm. Or inhaled steroids can in fact very often precipitate oral candidiasis, which is fungal infection, if it is not recommended. So use it with caution only if it is recommended. Right. It is not something which you just use it because you want to feel symptomatically better.
Right. Dr. Sanjeev Bagai, thank you very much for your time. So basic hygiene, self-distancing oneself as much as possible, and obviously with children and the elderly, just being extra cautious may just go a very long way, particularly during this high influenza seasonal period anyway. So Dr. Sanjeev Bagai, thank you very much for joining us.